Have you ever really stopped to think about the tiny organs that basically run the show in our bodies? I'm talking about the gonads, the testes in males and ovaries in females. They are absolute powerhouses, and they dictate everything from our development and reproduction to our mood and energy. But what happens when the signals from these hormonal command centers get scrambled? Well, that's exactly what we're going to dive into.
All right, so here's our game plan. First, we'll break down how this whole system is supposed to work. Then, we'll explore what happens when things go wrong, looking at males first and then females. We'll even focus on how doctors figure out something as common as a missed period. And finally, we'll wrap it all up with the most important takeaways.
So everything, and I mean everything, starts right here. It's called the hypothalamic pituitary gonadal axis, or just the HPG axis for short. The easiest way to think about it is like a chain of command. The brain sends a signal to the pituitary gland, which then acts like a manager, telling the gonads on the ground what to do. It's this beautiful, elegant system that is the master regulator of our reproductive hormones.
So what are gonadal disorders? Well, they're what happens when that chain of command breaks down. It could be that there's an underproduction of hormones, that's called hypogonadism, or maybe an overproduction, which is hypergonadism. Either way, these disruptions can mess with everything from fertility to sexual development and function. Okay, let's start by looking at male gonadal disorders. The best way to get your head around these is to think of them as different kinds of communication failures. Is the problem coming from the command center up in the brain, or is it a problem on the ground in the testes themselves? Now this is really cool. It shows you the two main types of male hypogonadism, and the difference is all about where the failure is. On the left, you've got hypogonadotropic. The problem is central. The command center isn't sending out the signals. So, what do you see? Low levels of everything. But on the right, with hypergonadotropic, the testes are the problem. So the command center is basically shouting, right? It's cranking out high levels of stimulating hormones, trying to get a response, but the testes just aren't listening. So testosterone stays low.
And the causes? Well, they are all over the map. For a central problem, it could be genetic, like Kalman syndrome. Or it could be caused by something like a tumor, or even severe malnutrition. For a primary problem, one that's in the testes, it might be a chromosome issue like Klinefelter syndrome, a viral infection like mumps, or, just the natural process of aging.
AIS is such a fascinating condition because it's not a production problem, it's a reception problem. Here, you have an individual with a male karyotype and internal testes that are producing testosterone just fine, but the body's cells can't hear the message. The androgen receptor is faulty. So the command center is sending all the right signals, but they're never received. This leads to the development of female external characteristics.
And some of these conditions are way more common than you'd think. Get this, about 3% of full-term male infants are born with what's called cryptorchidism or undescended testes. Now that number sounds pretty high, right? But the good news is that in the vast majority of cases, the issue just resolves itself within the first few months of life.
Another thing you see pretty often is gynecomastia. It's all about a shift in that estrogen to androgen ratio. And honestly, it's often completely normal. It tends to pop up during 3 specific times: in newborns, because of hormones from the placenta, during the wild hormonal swings of puberty, and then again in older age as testosterone levels naturally start to decline.
Okay, let's switch gears and talk about the female system. It's got its own unique set of complexities and challenges. Because the female hormonal system is cyclical, any disruptions can show up in very different and sometimes subtle ways. One of the big issues here is precocious puberty, which is just puberty starting way too early. And just like we saw in males, you can trace the source. With GnRH-dependent puberty, the entire command center, the HPG axis, just boots up prematurely. But with GnRH-independent puberty, you've got these rogue hormones being pumped out from the ovaries or adrenal glands, completely bypassing any orders from the brain. Speaking of those rogue hormones, CAH is a perfect example. It's a genetic disorder where a specific enzyme in the adrenal glands is missing, and this totally messes up the hormone production line. It leads to this big buildup of androgens, which, in a female fetus, can actually cause the genitalia to look more masculine. Now, one of the most common ways that these kinds of disorders actually show themselves is through the absence of a period. This is known as amenorrhoea. So let's take a look at how this one critical clue helps doctors figure out what's really going on with the hormonal command center.
Okay, first things first, you have to define the problem. Primary amenorrhoea means someone has never gotten their period by age 16. Secondary means they used to have periods, but now they've stopped for at least 6 months. And listen, before any doctor launches into a complex investigation, the absolute #1 cause of secondary amenorrhea has to be ruled out. And what is that? Pregnancy. So, once pregnancy is off the table, there's this really elegant diagnostic tool called the progesterone challenge. It's simple. A patient takes a course of progestin. If they get a period after they stop taking it, that's a positive response. That tells us their body is making enough estrogen and the plumbing is working just fine. The problem is simply that they aren't ovulating. But if there's no bleeding, that points to a bigger issue, like a lack of estrogen or some kind of blockage, and that means more tests are needed.
A really classic cause of amenorrhea, especially the kind linked to not ovulating, is something called the female athlete triad. You can think of it as the body's emergency response system. When the body detects extreme stress, like from really intense exercise combined with not enough calories, the hypothalamus, our command center, makes a tough call. It decides that reproduction is a non-essential luxury right now and shuts the whole system down to conserve energy. It's a protective measure, but it leads to this dangerous trio of symptoms: low energy, no periods, and over time, a serious loss of bone density.
And you absolutely cannot talk about irregular periods without talking about PCOS. It's one of the most common endocrine disorders in women, and it has huge long-term implications, not just for fertility, but for overall metabolic health. This table breaks it down nicely. The classic signs are irregular periods and symptoms of high androgens like excess hair growth. Hormonally, the dead giveaway is a high LH to FSH ratio, along with elevated androgens and, surprisingly, a lot of estrogen being produced from those androgens.
Okay, wow. We have covered a ton of ground here, from the command center in the brain all the way down to the hormonal signals firing in the body. So, what's the big picture? Let's boil this all down to the most important points.
So, what do you really need to remember? First, always think of that HPG axis as the hormonal command center. Problems can start at headquarters or out on the ground. Second, knowing where the problem is helps us classify it, just like we saw with the different types of hypogonadism. Third, remember these conditions can be something you're born with or something that develops over your lifetime. And finally, and this is key, symptoms are just clues. Logical tests, like that progesterone challenge, help doctors find the root cause. And that's the only way to figure out the right way to manage it.
Which, leaves us with one final big question to chew on. This incredibly intricate dance of hormones, all governed by this complex command system, shapes so much of who we are. Knowing how it all works and how it can be disrupted, it doesn't just inform our medicine, it really deepens our entire understanding of health, of development, and even of identity itself.